Hello guys, I am Deepak Shukla. Welcome to our channel Study Mania. Today let's learn about congenital conditions in larynx. The second video we have laryngeal web. So here we'll see about laryngeal web. Okay, so larynx develop from two arches, fourth arch and the sixth arch. Fourth arch will contribute to supraglottis, whereas sixth arch forms subglottis and glottis. Okay, so normally they have to fuse in a very synchronized way. Okay, or there is need to fusion, that is called canalization. In case of incomplete canalization between fourth and sixth arch, okay, the fusion is not appropriate. This forms laryngeal web, that is partial, okay, partial laryngeal web due to incomplete canalization between fourth arch and sixth arch. So there will be web formation mainly if suppose this is the anterior part and this is the posterior part, so it is mainly in the anterior 1/3, so there will be fusion or web formation in the anterior 2/3 of the vocal cord. Symptoms simply will have noisy breathing and difficulty in breathing because of partial web, space is reduced, or you can say obstructed. Okay, in case of complete web, if both things whole from ear till ear is obstructed, then we'll have biphasic stridor, okay, that is present both during inspiration and expiration. And also stridor worsens in crying, because in crying the vocal cords will be in the midline and already there was obstruction, and again we are pushing it to the midline, so this stridor worsens on crying. Okay, so children present with symptoms at birth in case of complete web. Okay, and there is no effect of position, lying or supine or prone, there is no effect of position. So what is the treatment? If it is complete web, need to do urgent tracheostomy, okay, and then release the web. How to release the web? Just cut the web, cut with carbon dioxide laser or knife. And for thick web, go for laryngofissure and placement of silicone keel. Okay, so three things: urgent tracheostomy, okay, cut with carbon dioxide laser and knife or knife. And for thick web, go for laryngofissure and placement of silicone keel. To prevent reformation of web, mitomycin can be used, okay, and debridement can be done. So this was about the laryngeal web. Coming to one more entity, we have subglottic hemangioma. Okay, now let's see what is this. Suppose this is a vocal cord. From vocal cord 1 centimeter, this area is known as glottis, and below that it is called subglottis. Okay, so in that subglottic area there is small malformations of arteriovenous system. Okay, so here in subglottic region, so while crying the hemangiomas will expand, causing complete obstruction of the airway. Suppose there is some hemangioma, okay, so on crying it will expand and causing obstruction of the airway. There is no variation in stridor during inspiration or expiration, and there is no positional change in the stridor. This hemangioma usually resolves with age, and it does not resolve. If it does not resolve, we have to give intralesional steroids, okay, and we can also go for laser application. So this was about subglottic hemangioma. Okay, if we summarize here subglottic stenosis, laryngeal web, and subglottic hemangioma, here we'll see that in subglottic stenosis, if the subglottic area is less than 4 mm and it does not present at birth because there is some space there, and there is no effect on stridor on expiration or expiration, and cry there is also no effect seen. But in laryngeal web, it presents at birth, there is biphasic stridor, it is an emergency condition, so we have to go for tracheostomy, and on crying stridor increases. Coming to subglottic hemangioma, it may or may not present at birth. If stridor is present, then mainly biphasic because of complete obstruction mainly, and stridor increases on crying, and there is no effect of inspiration or expiration or position in subglottic hemangioma. So this was about just like summary of these things. Okay, so this was about the congenital lesions in larynx. Thank you so much.